There we go, that's perfect. Just make sure the patient doesn't suffocate themselves. Okay, as far as our centering goes, we are going to be looking for our T7 once again. We look for that vertebral prominence, and okay, and from here we go down about 3 inches. So this should bring us to about T3, and this is going to be our centering.
Which is 3 inches from the
T7, from vertebral prominence. And because this is PA, we're just going to be straight here, MSP. Okay. And that's pretty much it. Get the marker. Which side do we mark?
Doesn't matter.
both the two.
Right, in this case doesn't matter, so we can just use the side closest to us. Okay, we can collimate in a little bit, right? SC joints are going to be like right here. Right? You imagine sternum, right? Clavicle, right? So SC joints are going to be like right here. So you can definitely collimate in a bit. And then the patient's left, so we'll just throw a left marker in here.
It's on the bottom.
Right.
Yeah.
In this case, you can just put it wherever. Here, really slanted, so I don't like it. That's why I put it on the flatter part of the back instead.
So
Do the arms have to be
That's
in
40.
this position or a different one?
Yes, so arms up like this is great because it lets the patient kind of like rest their chin on the arms or rest their forehead on the arms.
this
Right.
is for both
Keep it
bilateral
straight.
SC joints.
Right, so we do both SC joints in one picture. So this is PA bilateral SC joints, yes.
Oh, so
Or just PA SC joints.
if it's bilateral, is it 2 more?
No, in this case we can just do just the one.
Because then the other side is the other one side.
Right, now, right, so like in this case, because they're like pretty much together, it's kind of like how with the pelvis and bilateral hips, right? You only mark one side of the pelvis, even though you're getting both hip joints.
So what if the further straps are questioned saying?
They're not going to ask about markers, not like that. This is more for when you're in clinic. Because to be honest, every place does have their own like marker protocol. So what I teach you here is mainly what we do at Harris Health, but it's going to change when you go to other places. Don't take what I'm teaching you here as like law. Right? It's not set in stone. It can change depending on where you are. So be willing to be flexible with it, right? I'm telling you, okay, always mark the side closest to the IR in this way. But some places, they want you to do things differently. It's okay.
How come it's not locked?
The locks
Bilateral.
up there, the lights up.
Oh,
Yep. Electric there.
So okay, so they are prone, and then you find the vertebral prominence, and then 3 inches below the vertebral prominence,
So it's 3 inches inferior.
and then collimate
And you call me.
marker.
Good. And then, of course, don't forget, don't be like me and lose 10 points. If you can shield, don't forget
So
to
are we
shield.
just doing bilateral?
Yes, so you're going to be doing bilateral SC joints.
Okay.
So you've got this one, and then you've got the oblique. So oblique SC joints, 10 to 15 degree rotation, remember? So let's do our oblique SC joints. In this case, we're going to turn our patient very slightly to one direction. All right, so let's move this pillow out of the way, actually. Okay. So, which side do we want to turn to? Which SC joint are we interested in? Just name one, left or right?
Right.
Okay, so we want to look at the right SC joint. So we are going to take the right SC joint and put it closer to the IR. Okay? So in order to do that, the easiest way is to take this right arm and to put it down by the patient's side. Yep, there you go. So one arm down, this arm is still bent. And notice that when you do this, the shoulders naturally turn. Do you see how she's already naturally obliquing like this? One shoulder's lower, one shoulder's higher.
Yeah.
Do you see that? So that's how you can get an easy, quick oblique of that portion of the body, right? Of just that
So
top
the side we're
portion.
looking at the arm by the side.
Correct. Right, the side we're looking at is going to be the down side. The side we're not interested in is going to be the upside. Right.
And the same centering.
And now our centering is no longer going to be here at MSP. It's going to be slightly to the upside. If I remember, it should be 1 inch, 1 to 2 inches lateral from the MSP. So we're still 3 inches down from the vertebral prominence,
Okay.
but 1 to 2 inches medial from the MSP, from the spine right here.
So we go right?
So we're going to be towards
Oh,
the
left.
upside. So we're going to be on the left side, but we're looking at the right SC joint. And in fact, the book has a great image showing what's going on here. So if you take a look at this bottom one right here, right, notice that we're looking at one side, but we enter from the opposite side. See that? Okay, so if this is our right side down, that's the side we're looking at, we're entering from the left side, 1 to 2 inches. Okay? And that's pretty much it.
So the opposite.
And then as far as respiration goes for both of these, right, it is going to be suspend expiration. Right, we don't want to puff out the chest anymore, right? We want to bring the chest in, get the patient nice and close to the IR. So breathe out and then X-ray.
And the marker for unilateral.
Yes, so marker in this case, this is the side closest, the side we're looking at, so I'll go ahead and put this right marker over here. Okay. That's it. That's all the positions we have for this section.